I'm going to talk about another system of the heart, and that is what feeds the heart muscle to allow it to do its work. Those are the fuel lines of the heart, or the coronary arteries. And there's lots of things that can go wrong with those coronary arteries. They're quite small. They're also very susceptible to plaque building up on them. And that will impede the flow of blood to the heart muscle. So not enough oxygen may be getting to that heart muscle as it's working. As we can see, there are three main coronary arteries. There's one branching off on the right side from the aorta, right coronary artery, and there's one main branch off the left, and then that branches into two arteries, the left anterior descending and the left circumflex arteries. And as I said, these arteries are susceptible inside to building up with plaque. They're arteries and they have a muscle wall around them. The plaque that builds up inside the arteries is a real mixture of lots of different things, partly cholesterol and partly other processes and maybe even inflammation that adds to this buildup of plaque. It's important to know that that plaque doesn't just build up overnight. It builds up over decades. So it often builds up very slowly and gets bigger and bigger as we age. It may not even impede much flow until it's about 80% blocking the artery, and then we may have some symptoms. It's also important to consider that not just the size of the plaque is important, but the stability of the plaque. So there's a hard coating on the outside of that plaque, and if it becomes unstable, it can crack off. And then our body will go in to heal it and add a clot onto that. And that can take even a smaller plaque and actually make that plaque be completely blocking the artery so that there's no blood flow going downwind and no oxygen getting to that heart muscle. This is the most common mechanism of a heart attack. And that end result is that the person feels a lot, usually quite a bit of pain in their chest area. Sometimes it doesn't have to be right on the chest like that elephant on the chest. You can actually feel pain in different areas but still means that it may be coming from your heart. It could be your jaw, your back, your arm, your shoulder. Everybody's wired a little bit differently for pain. Any of these symptoms could be related to the start of lack of oxygen to the heart muscle, as we call angina, or the beginning of a heart attack. So it's important to recognize those symptoms, and if they don't go away, to seek treatment from a healthcare professional. The risk factors to build up that plaque are important to consider because these are things that we can work on afterwards to try to minimize any new growth and to help stabilize the plaques that may already be there. So there's some risk factors that we can change, and there's some that we can't change. The ones we can't change, of course, are our age, our gender. Men usually present about 10 years before women, but it's still a major disease for women as well as men. And as well, your genetics, so your family history also plays a role. And sometimes the family history and genetics will play a role in what our cholesterol levels are too. That can be a genetic thing. But we have to remember that we don't just inherit our parents' genes, we inherit their family habits quite often too. So that leads us talking to the things we can change. We know that the risk factors for heart disease are, number one, smoking. The nicotine circulating in the blood can add to that plaque and make it less stable. We know that people with diabetes have a higher risk of heart disease, this plaque buildup in the arteries. We know that high blood pressure as well, long-standing, can actually add to that plaque buildup over the years. Another important factor is cholesterol, our circulating cholesterol levels and the bad cholesterols that can float around. And they are actually kind of like the building blocks of some of that plaque. So we really want to make sure we address that. Some of the other risk factors are inactivity and extra weight gain, especially around the middle. And as well, importantly, is stress. And stress is something that we have acute stresses and then we have long-term chronic stresses. And both of those stresses can play a role in the development of that plaque progression. Fortunately, we can try to affect all of those things, optimize all of those risk factors, and we know that that will have an impact on the growth and the stability of the plaque. And that's where treatment after any kind of diagnosis of heart disease is aimed at.